COVID is affecting multiple aspects of our lives, and a big one, and one that many of us care about, are children. Many of us have children at home, and literally now at home because we are forcing to self-isolate. And with that comes the mental health aspect of it. And so mental health has been, we talk about it all the time before COVID, right? That children, and how do we best approach them when it comes to mental health. But I think now with everybody being home and the changes, we really need to address it and talk about it. And we will have two guests that are going to go into what they do and how you can look for signs and resources out there. But I'll start the conversation and frame it this way. In early May, Governor Lamont said schools will now be closed for the rest of the semester. And just anecdotally, just even talking from, I'm a university, I teach at a university, so my college students, even though that was closed before then, talking to them, and then talking to just other students I knew in high school and elementary school, many of them were devastated, and I think showed signs of depression, and I know many of them are anxious. And now we're learning summer camps are being closed, and there won't be pools for a lot of towns. And I just think it's a lot for kids to handle. So I guess my first question, actually, before I even get into that, let me do proper introductions. And Marisa, I'll start with you. Can you please just say your name, your title, and just a little bit about your background?
Okay. My name is Marisa Porco. I'm from the Jordan Porco Foundation, located in Hartford. I am the CEO and the co-founder of the organization. We've been around for 9 years. We're a national organization that we're focused on suicide prevention and mental health promotion, primarily on college campuses. We're actually in 43 states right now and over 250 colleges. And we have a program for a psychological resiliency program for middle school and high school students.
Great, thank you. And Sarah, can you please introduce yourself?
Sure. My name is Sarah Becker, and I work at Wheeler Clinic, which is a very large not-for-profit organization. We have about 30 facilities across Connecticut, and we provide primary and integrative care, as well as substance abuse recovery services and all sorts of mental health services and behavioral health services for folks across the lifespan.
All right,
and I myself am the director of community-based services and oversee a lot of programs, mostly having to do with crisis and suicide prevention.
Great, thank you, Sarah.
Sure.
So I'll swing back to you, Marisa, here for my first question. When many schools were closing and this all began to happen, you were in the middle of your program, so that you just were mentioning. So what anecdotally were you hearing from the students that you work with? What was Jordan Porco Foundation? What were you hearing from students? How did they feel? Just kind of want to get your experience on it.
I think that just the anxiety of not knowing and being, kind of stuck at home and not seeing your friends, and for students that were playing sports, kind of losing the identity of being part of a team, or the excitement of prom and graduation, and just the routine of what kids do with their relationships with their teachers, their relationship with their peers, if they're volunteering out in the community, everything came to a halt, the people they see on a regular basis. So it was really difficult for students to kind of adjust to this new normal and try to figure out, like, okay, here's the newness of this, and so maybe we'll do stuff on Zoom and we'll do this and that, but then after a while it just kind of takes a toll on the things that you were looking forward to, and especially the life transitions that I think are kind of, are big in this country in terms of graduating high school, and then some of the different milestones that we experience, as adolescents and young adults in college, whether you're graduating college or starting an internship or planning to travel abroad. So there was just a lot of, I think, chaos and just having to grasp the unknown. And so I think it all kind of boils down to, it really was a grief reaction, right? Look at the things that we are losing. We're gaining, but we're also losing. There's this loss of this previous life, and we don't really know what it's going to look like.
And I'm going to swing to you in just a second, Sarah, but Marisa, let me ask you one more question here on this regard. So, what you've seen through the Jordan Porco Foundation, I'm sure some very severe cases of depression, anxiety. And then you've also seen some where students have it, but not on that end of the scale, right? There's just maybe moderate signs, and I don't know all the clinical definitions, but I could see, I'm sure there's a scale, right?
Yeah.
So what warning signs should we be looking at now that we're parents, we have our children home? You're saying that they're feeling these feelings and these concerns and grief. Where do we draw the lines of your kid is, again, not trying to diminish the severity of it, but they're a little down, they're upset, they're down too. There could be a real problem here. I mean, how do you differentiate that?
Well, I think if you know that your son or daughter has a mental health condition, already has a diagnosis, maybe it was seeing a therapist on a regular basis or taking medication, I think that those parents are trying to keep a special eye on how their kids are coping. I know that for some students that suffer from social anxiety, not going to school actually felt like a little bit of a relief, because that was their struggle, right? But once kids go back to school, that's another kind of worry. I think for the other family members that just kind of had things were just going wrong as normal, and people were like, nobody really worried about their child's mental health, but maybe they're noticing changes in behavior. Maybe there's more anger, or maybe more isolation, more sleeping or less sleeping, nightmares, food, or people eating less, or isolating even more than just being socially isolated in their home, or just irritability with the amount of technology a lot of the kids that are doing online classes are feeling after being on a computer all day. I think all these behaviors, parents kind of really need to keep an eye on what's their kids' normal, looking at this under the umbrella that nothing really is normal, and really keeping the door open for conversations, being able to label it, name it, let kids have the opportunity to express things. But I also feel that, and also I think parents need to empathize with where kids are at right now. But I also think they need to really do the role modeling as well, in terms of a lot of the self-care that we talk about, in terms of getting through all this. I mean, there's a lot of talk about self-care, even more, because we need to figure out what these coping skills are. And so I think if we can model that in the home, especially even before we see any major signs, and having some things in place like routines and good discussions about this, and using exercise, and using some kind of hobby, or just talking stuff within the family at the dinner table. I think those are all really important things to really kind of get in front of things before things escalate.
Right. And Sarah, now I'm going to swing to you. So there is a resource that has been promoted, and it's called Talk It Out. Can you just please tell me, what is Talk It Out? What is this program? How would you describe it to someone who's never heard of it before?
Sure. Well, the Talk It Out line is a line that parents or caretakers of kids can call 7 days a week. And the purpose of it is just recognizing how many caretakers are under just enormous stress right now, as they're coping with being at home with their children 7 days a week, as kids are, many of them, having to do online schooling. And then for many parents, at the very same time, they're being parents during the day and educators during the day, that they're also, working full time during the day. So it's an enormous amount to juggle. And many parents are very overwhelmed, scared or anxious or depressed, or feel inadequate in the ability to be a parent. So they can call this line, and I would have to look down and provide the number, but I'm happy to, because I have to get these things in my own.
That's right, and we'll make sure we publish it too when this is posted.
Oh, beautiful. And so you're calling the line, and you're transferred to a local provider who is really there to provide a listening ear to help literally talk out your particular struggles or feelings that you might be having. And to help build upon the strengths that all families have, and they as caretakers have, and in general to provide some strategies going forward based upon the family's unique strengths. And all families and all parents have strengths to be had.
Great. And so, no, I know there is an association with the Department of Children and Families. Just please explain to me what that association is with DCF and with this line.
Sure. Well, very early on during this pandemic, the state of Connecticut, realized how many different groups of people would be under, enormous stress. And of course, one would be parents and caretakers. So immediately they wanted to get resources out for parents and caretakers to be able to call. The state of Connecticut called upon the Department of Children and Families to be able to get a resource up and running very quickly to help folks. From there, after there was a line established, they sort of put it over to the local providers. So as soon as a parent calls, they can remain anonymous. They don't even need to give their first name if they don't want to. It's helpful to know the town that they're from so that the family could be transferred to a local provider who might be able to provide resources. But other than setting the line up and making sure that it got up and running, there is no real connection with DCF.
And can you walk me through a call that you had? Just, of course, this is one call, anecdotal, but what was the nature of the concern? How did you handle it? Where did you redirect them? I mean, I'm just trying to figure out an exact example of what you do.
Okay, so I'd have to get an exact example, but I do want to stress that people are calling, caretakers are calling really for a wide variety of reasons. Some are very directly affected by COVID. They themselves might be ill, or a partner or caretaker may be ill. Some are worried about that they may be snapping or yelling at their kids, and it seems very unfamiliar to them, and they're feeling guilty or anxious about that. Some are just worried about how to balance it all, or worried about economic challenges they might be facing. So that's the type of calls that might be coming in. I'm trying to think of, maybe a typical call. There's a lot of parents who, of course, are co-parenting, whether their partner or spouse lives in their home, or whether they may be living apart. And this tends to result in communication challenges, as everybody's trying to do the best by their child. So it's really listening to the parents' stories and unique concerns, validating their concerns, helping them to be able to talk through their various feelings that are going on. And often the families are coming up with their own unique solutions to what's going on, hopefully with some strategic questioning on behalf of the clinician who's helping them. The resources that are offered and could be offered on the call are so widely varied that it's hard to point to one, because everybody's in a unique situation. For parents who are sort of looking for, the providers can provide certainly local resources, but can also point parents to, what is out there right now for anybody across Connecticut. One of the helpful sites is CTNewsJunkie.com, and folks can get on there and click through the various options that they might be needing help with.
And I know you're just one person taking these calls, but how many calls do you think you get in a week? Like, what's an average?
Well, that tends to vary, actually. In some weeks, there's several calls, or in some days, there's several calls. In other days, it just may not be as busy.
Sure. Okay, great. I'm going to swing back to you now, Marisa, and this is where I play bad guy here. Not really bad guy, but I start to play devil's advocate here, right? And I'm going to take, I think, something that does go through many parents' minds, and it's, look, kids get upset. I was upset as a kid. I've been down before, and the world is a tough place. We're seeing it right now with COVID. So I don't want, I know I should be empathetic, and I am, but part of it is that they got to toughen up here, and I can't be consistently and constantly coddling them. And now I'm starting to get, maybe too extreme, but you understand the mindset. It's, it's a little bit of tough love, and I know you're upset. I'm upset too, but we need to get through this, and this is going to make you stronger, right? So how do you respond? I mean, I guess, how do you respond to that? Where, again, is that line where it's, you maybe need to do that to a degree, or you could really be damaging their mental health and having some repercussions if you don't try to address some of this?
I think, in terms of all the advice that's out there, I think being honest with your kid, I think listening to your kids is super important now. I think that, obviously with something like that, Talk It Out, where parents need to be listened to deal with all the stressors they're experiencing and the variety that's out there, right? But kids need to be listened to. And if they're stuck at home with their parents or one parent or this, it's just a good place to just get it off your chest, right? So I think we need to listen to kids and we need to empathize and just remind them that they're not alone with how they're feeling. I think kids are resilient. I think we can, these are obviously the times where resiliency will be built, but with building resiliency, we need some of the coping skills. So it kind of goes back to, I'm trying to think of an example, but, things are getting a little bit, the energy is getting a little out of control in the house and kids are whining and, oh my God, I can't do this. And the feeling sorry for myself, which, hey, we all do as adults as well, right? It's just it's reality. Maybe that's the time where you say, okay, let's go out for a walk. I don't care if it's raining. Let's go and let's use some physical energy to get some of this emotional energy back in check. Trying to strive for that balance, or, trying to even identify, we never want our kids not to talk to us. You know what I mean? And I think that it's a real fine line between juggling, hey, we're all in this together, let's figure this out. And do you know what I mean? Like, or, oh, you need to grow up. Maybe that would be a statement that would come out of somebody's mouth. You just need to deal with this. And again, it depends on your child's age, their developmental levels, emotional development levels too. I mean, not every, fifth grader or 5-year-old is the same in terms of understanding how they process language, how they process information. I think, again, trying to get a bit of creativity in your parenting, and it may take all the resources that you have, but I think also for parents to call other friends or family members to try to figure out what they're doing to navigate this. I mean, we do this as professionals and colleagues when we get on Zoom calls. So what are you doing to stay connected with your staff? Let's do this as families, and so I think that I think it's a fine line. I think it's an excellent question, because you don't want to give in to the constant whining, feeling sorry for ourselves. And we just got to find, where is that positive silver lining? And I guess we all have to be really creative in trying to find it. And sometimes it comes in ways of maybe teaching gratitude to kids, or teaching about the simple things in life that really can make a difference. And I know that with the financial difficulties that families are facing, and the health difficulties, and again, the level of isolation, and it's just insurmountable. But I think that taking it one little piece at a time is a really great thing in terms of being in the present. Getting off the TV, don't listen to the news all the time. Being present may help with some of that building coping skills for kids and for parents as well.
And so along those lines, I know that's a big part of what your programs do, building coping skills, preparing. So with COVID now, have you had to make adjustments? I should rephrase that, because I know you've had to make adjustments to your program because they've had to be done virtually. But as far as the content or the way that you approach them, have you changed the way your programs are run, or do you come to the kids with a different mindset now? I mean, just how has COVID changed the way that you interact with the kids that go through your programs at the Jordan Parker Foundation?
So for the college program, it's been adapted for the virtual space, and we've had some really great success. And actually, we have a webinar coming up in a couple of weeks to be able to teach colleges across the country how to adapt if they need to go into virtual space, and really kind of keeping with the spirit of the peer-to-peer connection, the peer messaging in the different areas that a Fresh Check Day, the different messaging that comes out of the different booths for Fresh Check Day. So we've got coping skills, we've got where do you get help, some suicide prevention components to it. We have all that kind of built into that, and that's working out. In terms of our For What's Next program, again, that's a curriculum. It teaches very, very simple 5 modules, 30 minutes each, talks about mental health on a continuum, but also talks about when do you reach in to look at your internal coping skills, and when do you reach out to the people around you for the help when you're struggling. And so those are going to be adapted in terms of there's going to be, it can be taught in a virtual space, but maybe it needs to be taught instead of being 30 minutes. I mean, it can be 30 minutes, but maybe there's modules that we repeat, because we know that sometimes all this screen time just makes us kind of tune out. Like, so in terms of engaging students, it is still something that is and can be done to teach kids some basic understanding of mental health, what it means, how you can go from, you know, one end of the continuum to the other, and kind of keeping an eye on that, but also practicing what it takes to kind of keep you in that place where you're feeling okay. So that's been our adaptation. And again, it's been developed to really be easy for anybody who's working with kids to be able to use it. And that's the For What's Next program. It's forwhatsnext.org. Any person who's serving youth, and you don't have to be a teacher, you don't have to be a psychologist. You can be a mentor, you could be a peer youth leader in a church or a Boys and Girls Club. You can have these very, very kind of solid conversations, and conversations that open up more more discussions about mental health with kids in a way that's not intimidating. And I think, you know, for the folks that are using it, it really kind of gives a little bit of a break to parents, because the kids can bring it back to their parents, you know, or you know what I mean? They can maybe have conversations. So this is what I learned. Maybe we can do this as a family, or maybe we can do this because we're all feeling a little stressed out.
Right. No, thank you. And Sarah, I know there was another program that I wanted to talk on about before we have. I have another question for you all, but before we wrap up, there was another program I did want to get to, and that was the Youth Mobile Crisis Intervention Service. Talk to me a little bit about that. You know, who's associated with it? What is that program? How's it different from Talk It Out? Just a little bit of a background on it.
Sure. So the Mobile Crisis Intervention Service is a 7-day-a-week program that offers crisis intervention, but it certainly does. And it's for really any parent who is concerned about their child's behavior or emotional well-being, and perhaps it is that behavior that seems unusual for the child or seems somewhat risky. So parents can call, or caretakers or teachers, emergency departments, all sorts of folks call, and they would call 211 and press 1 and press 1 again. And then they're transferred to a local mobile crisis team who can provide immediate assessments of a child. And from there, looking at the level of risk that could be going on, we help the families to create safety plans for their kids, and sort of plans of what to do next to manage their child's emotional well-being or risk. And then the service can provide up to 6 weeks of follow-up care for children who need some stabilization before heading back into the world, or maybe are being linked to another provider. We also have done some adaptations, or mobile crisis in general has done some adaptations. So we do continue to provide some mobile services to families if the families feel safe in having us there, and if there's really no risk to the staff members going out to their homes. We also provide telephonic support as well as video assessments. So it was something that was a little intimidating to many parents at first, or to kids at first, but they're finding it really quite easy to, in general, to be able to log on and speak to a clinician just immediately in the moment and get their children's status assessed, and coming up with plans to help them going forward. So it's certainly up and running throughout the entire COVID pandemic situation.
And how is the program funded?
That program is funded primarily through the state of Connecticut, and also through the Department of Children and Families. And just like the Talk It Out line, though, although it's set up by DCF, anything that happens from there, the calls are coming into 211 and passed on to local providers. And from there, the department might keep some information about, say, the ages of children who are being called about, or the presenting problems, but there's no direct connection with DCF, with the exception of if there is a clear child abuse situation, as many people are across the nation, across Connecticut. We will call the care line, and it's really just if we're worried about a kid.
Right, just as it would be at a school, but other besides, it's the same
So
guidelines.
any professional coaches,
Coaches,
religious
right.
leaders, and sometimes it's neighbors or other folks who are calling just because they're worried about a kid's well-being.
All right, so Marisa, I'm going to come back to you now, and you've said this in multiple ways, but now if you could try to do it in maybe one direct way, what is the best advice you can give parents during this pandemic as far as their children and their mental health? What is your golden piece of advice?
My golden piece of advice to parents is take care of yourself. The old adage where, you need to, if you're on a plane and you got to get your oxygen mask, you need to take care of yourself so you can be present for your kids. And I think that's a great example. And if you can get the support you need to figure out what that oxygen mask is for you at any given point in time, it's the best thing you can do for your kids.
And Sarah, same for you. What is the one piece of advice that you would give for parents during the pandemic with their children?
That is what Marisa said is absolutely how I would see it as well. For parents to be compassionate and gentle with themselves, they and all of us are in a situation that none of us have faced really in our lifetime. So to be forgiving of themselves, gentle with themselves, to certainly take care of themselves, and in terms of helping them within the family, it can be very helpful to set up some structure within the family, limit exposure to all of the troubles around us right now, and to, just like Marisa said, to focus on perhaps the silver linings of what is going on. And it may be new activities the family is doing, new ways of connecting with folks, their neighbors or relatives or friends. So there's so many things they can do, but to take care of themselves and to be able to find a way to express the concerns that they're having right now.
And so I'll just close with each one of you, very briefly. Is there anything that you want to add that I didn't ask that you think is important to contribute to this conversation? And I can start with you, Marisa.
I think just one thing that I would say, and I would say this before COVID, is for parents to, just like we educate ourselves about physical health, we need to educate ourselves about mental health. There's great resources online. There's great folks to talk to. If you have any concerns, or that there's a familial history of mental health issues, and you're worried about how the stress may be impacting your child or yourself, there's great resources out there, and it's okay to just look those up, just to take care of that part of your being. We're all humans, we're all under a lot of stress, and if we look at that just like we look at just like we look at hand washing and everything else we do to take care of our physical health, I think we're in better shape. Whether it's talking to your pediatrician or talking to your primary care, bring up the conversation and kind of keep that on the regular part of your routine.
And Sarah, anything you'd like to add?
I think it's just important to realize that, there was a lot, I think, of assumptions initially that things weren't up and running. And I think that, so that everything must be shut down now, and that services that we rely upon weren't there. And then indeed, the help is there right now. Whether it's through, here in Connecticut, whether it's through the Talk It Out line, or if you need help with your child through the mobile crisis intervention services, but that, the outpatient services and therapists and so on, people are up and running. So to make that it's okay, number one, to realize that we may be under more stress right now than other times in our lives, and the help is available, and it is great if you could try to reach out and get it for yourself or your family if you need to.
Well, I want to thank you both for, first of all, volunteering your time to have this discussion, and also for the work that you do working with children. So we appreciate it, and we'll make sure that we have these resources posted when this all gets published with the article too. But just thank you again.
Sure.
Thank you so much, Adam.
All right.
Take care.
Take care. Bye-bye.